everyone. We are live at Aster.
Some buffering time.
Good evening and warm welcome to everyone. We are live at Aster CMI Hospital, Bengaluru, and we are joined by our experts, Dr. Govardhan Reddy, lead consultant, Department of Urology and Uro-Oncology, and a transplant surgeon, Dr. Vidyashankar, who is the lead consultant, Department of Nephrology, and a transplant physician. And I'm your host for the evening, Dr. Shashank, consultant in Department of Nephrology. So today we'll be having a talk on transplant patient care during the time of COVID. So sirs, could you briefly tell us about kidney transplant during the time of COVID?
Yeah, most of the people have got an anxiety whether kidney transplantation is safe during the time of COVID because the people are now really scared even to enter the street because of the so much of infection happening all around. So certainly the transplant patients are high risk. So in such situation, actually should we venture into kidney transplantation or not during this time is really a question. But the thing is that since we have patients where the kidney transplantation has to be done on an emergency basis because otherwise they are going to have more complications of dialysis, so kidney transplantation certainly can be done with certain precautions.
Anything to add, sir, from Dr. Govardhan from?
As far as surgery is concerned, the surgery remains the same, but what we have taken extra precaution is that we are beforehand testing these patients for COVID testing, and the procedures which we do in the theatre has slightly been modified, wherein all the precautions which are needed for COVID-19 patients are implemented in the theatres. Even the theatre which we have selected for the transplant is in COVID-19 prevention features are there, like negative suctions and the air circulation and the number of people who are going to stay in the theatre during these procedures, and also all the people who are working presently in the theatres are all COVID-19 tested negative people. So we have taken utmost care, and we are doing with extra precaution. Then normally transplant itself is done with the extra precaution, and since this COVID has come into existence, there is a lot of other things which have been brought into doing the transplantation.
So, sirs, we have a few questions from our viewers. So, first is, are transplant recipients at a higher risk of getting COVID-19 infection?
Yeah, certainly the transplant patients are, as such, even if they are transplanted earlier, or patients who are undergoing transplantation during the time of this epidemic, they are definitely more risk because they are immunosuppressed. So, especially now, if you look at the entire world data on people who have higher complications of COVID or people who are elderly population where their immune system is low, they are diabetic patients, or patients who are on chemotherapy. Wherever the immune system is down because of this multiple issues, they are the people who are at risk. So certainly the transplant patients are at risk of something more than the general population.
Slightly moving away from COVID-19, one of our viewers have asked, what are the homemade remedies for urine infection?
As far as urine infection is now, homemade remedies, we do advise a few things in urinary tract infections. One definitely is consuming enough water. Again, the water enough has some meaning. Here, a lot of people end up drinking a lot of water. It's not a lot of water, it's enough water. Probably in this scenario, probably around 2 liters would be good, and probably if you are in a very hot climate where there's a lot of sweating, probably around 3 liters. One. Second thing is timely voiding, means timely passing of urine. So we definitely encourage no delays in urination. Apart from that, a few things what we take orally in the form of what is called barley. Barley is supposed to be good for urinary tract infections, and also cranberry juice is one which has been studied little extensively, where they say it is good for people who have infection, especially people who are having recurrent infections are definitely benefited from these things. So basically, more than all these things, it's like you have to have a good habit of timely emptying your bladders, not delaying it. So these are few things which you should follow, and some good personal hygiene.
So another question is, how will I know if I have prostate-related symptoms, and can it be managed medically? Or in other words, when do we go for surgery, or when can we manage medically?
Yeah, prostate. All the males have prostate, and the prostate problem increases with the increasing of age. Normally, we try to see prostatic problems coming up around 40 years of age, and gradually people may present with different severity of the symptoms. So basically, most of the time, managing the prostate is more of a medical line of management. So basically, when a patient with prostate comes, we take down what are these symptoms, then we subject him to few tests like an ultrasound to know what is his prostate status, whether it is emptying the bladder completely. We do what is called a uroflow test to know whether the flow is fine. If the flow is fine or little decrease in the moderate amounts, then if there is no lot of high residual urine, or whether if he has not had any infection, these are patients who can be easily managed with medical management. And most of the time, medical management can prolong the thing, or sometimes people becomes normal. But sometimes they may, over a period of time, wear off the effect of this medicine, and they may need some procedures.
Coming back to COVID, are younger transplant recipients at an increased risk of COVID-19 infections?
It's a good question from the viewer. Actually, if you compare the older transplant recipient to younger transplant recipient, certainly the risk is slightly less compared to because the immune system is good, the immune system is intact. So people who are like older, like transplant patient, like more than 60 years, who are intentions or go transplant during this time, they are very high risk. Certainly, whatever transplants we have done during this epidemic, we have done 3 transplants in last 3 weeks, and we have a few more lined up. All these patients are younger patients because they are like almost like a normal patient because they have a good immune system. But compared to the elderly population, they are at lower risk. Certainly, they are at lower risk. So, if they are elderly, they are planning for transplant, especially this time, it's better to avoid. Better question.
Does Imdur cause?
So we have a question from Sophia Xavier who's asking, does Imdur cause kidney problems?
See, Imdur is nothing but it is a coronary vasodilator. It should not cause any kidney related elements. It is very safe. It's basically given for a cardiac condition, so it doesn't cause any kidney related.
Following up with that question, she's asking whether statins are dangerous for the kidney.
Yeah, that's a good question. Actually, the statins, they cause kidney related issue by 2 ways. One is the statins can cause muscle injury, especially if they are taking along with that certain drugs like we call calcium channel blockers. If they are like amlodipine or certain group of drugs are combined with very high dose of statins, it can cause something called rhabdomyolysis. That means the pigment from the muscle comes out and it can cause temporary kidney issue. That is common, and especially when they are dehydrated, when their hydration status is not good, they can have kidney related. Second thing, that there are certain case reports of statins causing allergic reaction in the kidney. So that can also cause kidney related, but it's not a permanent kidney damage, but it could be a temporary kidney damage. So certainly statins at a higher dose can be indirectly, it can cause the kidney related issues. Yeah.
So we have another question from Mr. Govardhan Kumar, who asks, how can I control my creatinine level?
He is a ESRD patient.
Yeah, he is actually, in fact, reading his question, he's on dialysis. Actually, in dialysis, the creatinine is not a marker for kidney function. Once a patient is on dialysis, it indicates nutrition. So, if any creatinine less than 6 in dialysis is not a good sign because they are losing a lot of muscle mass. So, ideally, the dialysis patient should have a creatinine value somewhere between 6 and 10. And if they are undergoing 3 times a week dialysis, don't even look at your creatinine report because it's the more the creatinine, the better will be the outcome because they are eating more proteins, more muscle mass. So certainly, the higher the creatinine value during dialysis is not a bad sign, provided they are undergoing at least 2 or 3 times a week dialysis.
So coming back to our questions from our viewers, how can dialysis care occur during this time of COVID?
So dialysis is because here their patients are getting exposed to other patients who are come into the unit, and they have to travel to the dialysis unit once in 2 days, once in 3 days. So what usually we tell them is to wear a proper one is proper mask, then hand sanitation and social distancing. These 3 things are very, very important. So if they can take care of that, then certainly the risk will be very low. And avoiding contact with people who have got symptoms of cough, cold, fever.
So coming to sir, how can COVID-19 affect transplant surgeries? In other words, as a surgeons, what are the precautions which you have to take in managing such patients?
So, in a situation like COVID-19, as I told you earlier, we have taken extra care than what usually we take it for a normal transplant surgery. So basically, we try to limit the number of people in the theater. All the persons who are in theaters are well protected in the form of PPEs. And thirdly, what happens is even these patients who preoperatively or in an isolated environment. Similarly, after surgery, they are again moved into renal ICU department where only the transplant patients are kept. No other normal patient is there. So what happens is there is a complete pre-operative to the post-operative to the discharge time. They are almost they are isolated. They come into the theaters, which are again COVID protected, and then again they go to an ICU, which is COVID protected. So all the measures which are necessary has been already taken doing these procedures.
So
There is a question.
So Mr. Damodaran is following up with the same question. He is on Levipil 750 mg tablet. So is it any extra problem with the medicine taking this tablet during time of dialysis?
No, Levipil is not it doesn't have any damage to kidneys. The only thing is that especially if you are undergoing dialysis, this drug will get cleared in dialysis. So you have to be careful. So after dialysis, you have to supplement with the dose. So, but it doesn't cause any kidney problem.
So what urological cases can wait, or what urological emergencies have to come to the hospital or can wait during time of this COVID-19?
No, now the situation has changed. We are not now in what is called that acute phase of COVID. Second thing is still we are not having any treatment as such for COVID. So to say that we are out of COVID is not possible for the present situation. And now we have to learn to live with COVID. So for that, what has happened in the hospital has made a very clean policy of how to take in patients. So basically, if we have any doubts of somebody having a COVID-19 possibility, they are totally taken out. I mean, they go to a flu clinic or a fever clinic, or if they have come to emergency, there is a separate what you call bay for them, and where they are screened and they are again sent to a different ward or separate ICU, and from there they go to a ward which is separate. So they don't normally interact with the normal patients who are non-COVID. Even non-COVID patients or anybody who is coming into the hospital start with first measuring the temperatures and giving a sanitation, and then when they come to the OPD clinics, in OPD clinics also they are asked few questions, and only once they are satisfied they come into OPD. Even in OPD areas, the hospital has made provisions of social distancing, and number of patients what we are seeing at present in an OPD situation has come down. We have reduced the number so that we have enough time in between patients, and all the necessary precautions like cleaning the area, sanitizing the area of every patient is being taken care. And as such, for all the surgeries, whereas we take all the precautions before they go into surgery. So now, what I would like to say is, now we are in a state where we have to know how to live with COVID. We can't run away from COVID till we get some solution, a permanent solution for COVID. So just mere presence of COVID we can't postpone most of the surgeries. Okay. So people also should try to understand this, and they have to get their whenever they need a treatment, they have to get the treatments done.
So anything you want to add?
No, that's like for example, certain procedures which were previously treating, like initially first phase of probably lockdown, only emergencies were handled. Now, since after lockdown 3-4, then many people they have to undergo procedure, because this is, as I said, it's going to be with us for a longer time. So we have found out a way out, like how to take care of these patients, and then how to be ourselves safe, but at the same time how to keep the patient safe from the COVID.
Hello, Mohan. What to next question?
So Damodaran is following up and asking us whether is potassium and electrolytes, that is sodium, potassium, is normal, but he has problem with creatinine and urea. So how can he improve, or is it possible to improve his renal function?
See, since you mentioned you are already on dialysis, so since you are already on dialysis, there is no way of increasing your GFR, because once you are on, of course, your all parameters are good because of good dialysis. Because dialysis is like having food. Because of dialysis, your all parameters are good. Once you stop dialysis, then other things will become haywire. So here there is no other mean of increasing your GFR, because your GFR is anything, any creatinine more than 5, the GFR comes to less than 10 ml. So that way, some people who may be off dialysis without symptoms, but certainly in your case, I think you are doing good because you are undergoing good dialysis. So not to worry about the GFR. I think you should eat well, take good dialysis, keep nutrition well, those hemoglobin more than 10 grams, all those things, you can lead a near normal life.
So one of our viewers have asked us, are people born with a single kidney at an increased risk of COVID-19 infection?
People with single kidney, with normal kidney functions, they are not at high risk. They are at the same risk. But only thing is, people born with single kidney, they have something like they have other things like diabetes, they have some lung disease, so their risk goes up. But single kidney per se, it doesn't increase the risk of any COVID. It's the same as general population.
So this next question is partially answered, but is our hospital prepared for a transplant during such a situation? If yes, what are the precautionary measures taken by the hospital?
Yeah, as I told you, we have already implemented the required precautions for the renal transplant, and we are well prepared to undertake this surgery. And we are having done few patients during this time. So they have done well. They have not had any complications, and it is almost same to pre-COVID time. So same patients get admitted, getting discharged by 7 days. The same thing happening. We are not seeing any new trend or new things happening. And till now, what we can say is our hospital is still what's called COVID negative hospital. So it's like though we don't have COVID cases, still we take all the precautions of COVID. So I think nobody should be worried if at all somebody has to undergo any hospital which has all the precautions taken and which is more or less having a COVID negative status, or an hospital who has COVID cases but they have a separate block, they are segregated. I think all the surgeries, including the transplant, should be possible in this situation.
So we have a next question, very interesting. How long can I delay my kidney transplant surgery?
The kidney transplant surgery, because it is like people, they can sustain life on dialysis. That is one thing which because dialysis transplant is not a mandated thing to happen. But certainly, since this is like an epidemic which can last for longer time, especially people who have got problems with dialysis, like they have very bad fistulas or somebody where the transplantation has to be done because they have more competition with dialysis, the BP is not stable, or certain younger age children. Those people, I think, definitely they have to go for transplant. And after transplant, the risk remains slightly higher, probably slightly higher, because of this new virus, which is otherwise. As such, the transplant patient has to take all the precautions, like wearing this mask. We tell them to wear mask throughout their life. Especially all our transplant patients, we ask them to wear only N95 mask, even without an epidemic also. Certain things will not change, but definitely if they have some complication during dialysis, if they are expecting they can't wait for more than maybe 2 months, 3 months, definitely they should undergo.
So we have a question from one of our viewers. This is Atira Prakash, who's asking, what are the causes of urinary tract infection?
So basically, urinary tract infections are quite common in people who have some problem in the urinary tract. Some people can be born with some defects in the urinary tract, or some people over a period of age, when they are aging, they may have some problems in the urinary tract where the normal flow of urine is disturbed. That can be again because of any what you call prostate in a male, it can be a prostate enlargement, or there is a stricture, that is tightening of the urinary passage. Similarly, in females who can have a tight urethra where the urine doesn't come out easily, or some people who already have some stones or more chance of having a urinary tract infection. Somebody who has had any surgeries or any intervention can have more chances of stone. Some people who are on permanent catheters are highly susceptible to infection. Similarly, in some patients, especially diabetics, diabetes are also more prone to have infections. And if you take younger age group can have, in some cases, what we call as honeymoon cystitis, is more related to sexual activity. So which we commonly see in our practice. So most of the time there is a cause. And apart from the small things like, the habits where people delay urination, people travel with full bladders, so people have constipation, they are prone to have more infection. Those who don't know how to take care of personal hygiene have higher chance of urinary tract infections.
So Principal Jose is asking us, what are the symptoms of coronavirus patients in dialysis patients?
The symptoms of coronavirus disease, as you know, it's like a flu-like symptom. Like they can have this sore throat, they can have cough, then body ache, then breathing problem. These are the symptoms which are definitely root symptom, but many patients, they are asymptomatic. But in dialysis, particularly, sometimes the dialysis patient can have breathing problem. So sometimes if they have fever, so it may not exhibit, it may not very high fever. So usually whenever we tell them, suppose you have any new symptom like they are having some tiredness, body ache, or some feverish, or some sore throat, or some contact like you are got exposed to somebody suffering from this. So we have to be very careful. Yeah.
Mr. Madhusaw is asking us, please share some key points for patients with kidney disease, or any pointers which we can share, or tell them, tell us that probably they are suffering from kidney issues.
Suffering from kidney disease, the symptoms are basically the kidney disease is silent. That is one thing. It is like a tip of the iceberg. The people will get symptoms only when they have more than 90 to 95% of the kidneys are damaged. Very few kidney diseases where symptoms can present little early, but most of the times we diagnose the patient whenever they go and for regular health checkup, or whenever they get your blood pressure checked for blood donation. So such situation where you get to know you have some kidney problem. So otherwise symptoms are like swelling of the legs, then they can have some blood in the urine, blood pressure can be high, or swelling around the eyes. They can happen, but they are very small numbers. So ideally what we suggest is that you should undergo a kidney test, that is serum creatinine and urine routine test, at least once in your once in life, like it once. Sometimes after menstrual checkup they do it, but it's better to do it at any point of time because it's a silent disease.
Mr. Mohan is asking us, can transplant patient recover from a COVID-19 infection?
Yeah, certainly there are transplant patients. Of course, there are, in fact, transplant patients also got COVID in other countries. They have recovered. Certainly, they have recovered. If they recognize symptoms and if they are hospitalized early, or if they are given proper supportive care, they have certainly recovered. Their mortality or what you call death rates are not very high compared to them.
Mr. Damodaran is following up with the earlier questions. He's asking, why do small children have kidney disease or a chronic kidney disease? Why do children have kidney?
Yeah, children can have kidney disease because of most of the time it is because of the urological issue. Dr. Govardhan Reddy will just highlight on the urological issues which are very common in children, which they can land up in CKD.
Yeah, basically some children usually they are born with some defects in the urinary tract. So they can have either a single kidney which has a problem. A normal single kidney is not a problem, but a single kidney which has problems like a block in the kidney area can have problems with the when they have two kidneys, again if those two kidneys are blocked, again they can have some problems with kidney disease and they can go for, if it is not identified, corrected early, it can go for a chronic kidney disease. Similarly, there can be chances of some problem with the tubes which come from the kidney, that is ureter, where the urine goes back, we call it as reflux disease. If the reflux disease is very high grade, for longer time, not noticed, not found, then they also can have problems. And there are other conditions like the external part where there's a block, like we call as posterior urethral valves, where the blockage is there for the urine and there's a back pressure changes in the kidneys and bladder. Even these people can have a chronic, there are various. Basically, we can say all these are congenital deformity. But what has happened of late is because a lot of scannings are going on, premarital, that is pre-delivery, prenatal scannings are going on. We do pick up a lot of cases early, and most of the times the remedy is given as soon as they are born or as early as possible. Once the child is fit enough, then the remedies are given. So in children, most probably it's the congenital problems which cause the chronic renal disease.
Next question is for Dr. Vidyashankar sir. Does hospital provide home care services for dialysis?
Right now, we have not started the home care dialysis in hemodialysis, but certainly we have peritoneal dialysis where we can offer the home care. They can come and do it. Yeah.
So, we have finished most of our questions which were asked by our viewers and from our live viewers as well.
Okay, what delay is that the transplant?
Yes, we do.
Mother.
Yeah. You're asked, how long can we delay the transplant surgery? We have asked the question.
Okay, fine.
So,
if there is any questions?
anything from the audience, any live viewers, if they're asking us questions, I think we'll be happy to answer them.
Or you can forward to this thing.
So that's a wrap for now. Thank you viewers for joining us. Hope this session was very fruitful for all our viewers in creating awareness about kidney disease and the COVID-19 situation. We have answered most of the questions which are asked by our viewers. If there is any extra questions, please put it on the comment section. Our experts will be very happy to answer it. Thank you very much.
Thank you.